Welcome to week 4 of your Pharmacy Career Planning 1 course. This week we are going to be covering Chapter 3. Chapter 3 is about the long-term care pharmacy. So last week we discussed the different types of long-term care settings. So this week what we're going to talk about is the pharmacies that actually service those types of long-term care facilities. So in general, a long-term care pharmacy is any pharmacy that's dispensing medication to residents in a long-term care facility. And as we said last week, that long-term care facility could be a nursing home, but doesn't necessarily have to be. So depending on where that facility is, how it's related to other facilities within, where it is, like is it part of a large system? Is it part of a hospital system? What is it? Depending on that, that can determine how it is serviced. So we might be using a small independent community pharmacy that's servicing the residents in a facility that's, locally owned and things like that. Or we might be talking about a large volume long-term care pharmacy, and that's all they do. Omnicare is an example of one that you might be familiar with. I actually worked for that company years ago, and they service all kinds of long-term care facilities all over the area, in the St. Louis area. So again, it just kind of depends on where the facility is, what kind it is, what kind of needs they have, and things like that. So basically, there's two types of long-term care pharmacies. There's what's called an open shop and a closed shop. So an open shop typically services more than just the long-term care pharmacy. So this might be your local retail pharmacy who also happens to service the local nursing home as well. So that's what we mean by open shop pharmacy. And a closed shop pharmacy is just for long-term care residents. Now, they may be servicing a specific facility, or they may be servicing multiple facilities. But either way, you can't just walk in and get a prescription filled. That's what makes the difference between an open shop and a closed shop. So within either one of them, you're going to have some of the basic elements of a pharmacy. You're going to have personnel. You're going to have inventory. Obviously, you're going to have a specific pharmacy design, equipment and supplies, and delivery service. So within the personnel, typically you're going to have your pharmacist, and that pharmacist might perform several different roles. So they're not just there to check that the prescriptions are filled properly. They're also going to be doing something called medication therapy management. So what that means is they're going to actually be working hand in hand with the facility to make sure that the patients are getting the proper medication therapies. So we don't want, when we have a patient in a long-term care setting, especially if we're thinking of those nursing home type of patients, we want to make sure that they're not taking things that are going to be interacting with each other and things like that. So that's a key function of the pharmacist in a long-term care facility. Of course, we're also going to have pharmacy technicians, and depending on whether or not the pharmacy is within the facility or not, they might be part of the actual distribution of the drugs within the facility. We would have a delivery person if we are off-site. And then obviously there's going to be someone involved with billing, because billing is quite a complicated thing within a long-term care facility. A lot of our inventory is going to be the same, although there are some things that we're going to have more of than others. When you talk about a long-term care pharmacy, you're going to have things for that clientele. So whatever that particular clientele is, that's what you're going to have as far as inventory. So you might see things like, suppositories, liquid medications. They might not be able to take regular oral meds and things like that. One of the other things that I want to point out to you when we talk about the type of inventory that they're going to have is the unit dose system. When we talk about a unit dose system, that is one of the drug distribution systems for long-term care. And so basically what that is a single unit package that's dispensed for administration. And so it's, like a little it's going to have a single tablet in it or a single capsule, things like that. A lot of times what you're going to see in a nursing home facility is unit dose cards. So what that is it's an actual almost like a cardboard type of card, and it's going to have individual doses in each little bubble, and you'll pop those out for dosages. So that's kind of something a little unique to long-term care that you may or may not be familiar with. So as you go through this week and you learn about some of these new things, make sure that you reach out to me with any questions that you might have, and have a great week.